I'm Dr. Mark Stoebe. I'm a chiropractic orthopedist in Montana for about a third of a century. Over the last 3.5 years, or about 10% of my practice, I've been utilizing the Cluffy Wedge. The reason that we do it is, with our patients, classically we do a functional analysis. We do a selective functional movement assessment, which incorporates global flexion, extension, rotation, as well as squat test. We find often with squat test that patients' ankles don't adequately dorsiflex, which indicates that typically we're going to treat the posterior ankle ligaments. But also we examine the first ray, and it's essential to us that the first ray extends. If that doesn't happen, the foot does not function correctly. It's been our experience in treating a few hundred patients with these wedges that more than half of them that we put them in get some sort of positive benefit, apparently just from the wedge. We also do other manual treatments to the muscle as well as manipulation. But we found that, again, at least over half of the people with axial pain, so they have a hip discomfort, spine pain, something on that order, get some sort of benefit from this wedge. It's also been our experience with people with focal problems in their foot, ankle, or anywhere in that extremity, that probably 3/4 of them get some direct benefit. And I suspect that is because we're getting the large toe to extend better. This wedge helps when people have a ligament that's not in a correct vector at the first MTP joint, and this device makes sense because it allows the angle of that ligament to be more correct and therefore allows the toe to extend. We know that in the hand that the thumb is more than half the hand, and likewise in the foot, the large toe is more than half of the function of the foot. So by placing this wedge in people, we're finding that at least half of them do better out of the chute. If all they have is back pain, if they have foot pain, they tend to do better than that. This device works well both with and without orthotics. They're relatively inexpensive, and we haven't had one single person that we've put them in that said it's made them worse. So certainly for the cost benefit ratio, it's a very viable additive to our practice, not only with back pain patients, etc., but with people with foot problems as well as with the athletic population, because it tends to help them move their foot better and therefore their whole structure.